Welcome to my podcast. Today I'm going to talk about another one of the commonest case presentation in children age group. So basically, after you introduce yourself to the patient, double check the patient date of birth and name. Usually in those kind of cases, it will be escorted by the mother or the parent. So the mother will tell you, oh, doctor, I have my son or my daughter who has developed this boogie mass on the face or in the head, on the scalp, and it's not improving. I've done whatever I can do, and it's not improving, and just the child is annoyed, crying of this mass, just want to know what's going on. So in that condition, you need to think what might be the differential or the risk factor in that kind of age. So firstly, you need to think about skin infection. By that, basically bacterial, fungal. So you will ask if there is any fever, if there is any other member of family who's affected, if there is pets at home, if the child had done anything unusual in the last few days, if he mixed with anything that's unusual as well, if there is any member of children in the school, the same thing, who is mixing with. And then you will ask if the child is acting okay, if he's himself, if he is eating okay, drinking okay, playing okay, sleeping okay. And then you will think about if there is history of eczema, for instance, because this is another condition that you need to think of. Also, you will explore if there is any scales, itching, which could point out to tinea. And then you will ask if there is any thought or ideas that the mother might have about this. So she might tell you, he has done this and that in the last few days, and it could be related to that. And then you'll ask if there is any past medical history, and if the child has been born okay, normally, normal vaginal delivery, and if he's growing okay, according to the Red Book, and if he's up to date with his vaccination, and if there is any concern that the mother might raise. And then you will tell her that I would like to have a quick look around the lesion and just try to see how the lesion look like, if it's oozing, if it's bulging, if it's discharging any pus at all, or if it's firm. So you will just try to see what size is that, what color of the lesion, if there is any scales, if there is any popping out hair, and then try to touch it and see if it's boogie, if it's firm, if it's fluctuating, in order to decide what sort of a lesion is that. So, assumably, it just was a red thing, no scales, and you just send away the mother with topical steroid like momentazole or 1% hydrocortisone, and the mother come back and says the child failed to improve. So in that condition, you need to review if there is fever, if there is any change in the condition. You might try topical antibiotic as well. Mother says didn't work. And then after some time, the patient started to have lymph node, fever. So you start to think about abscess or inflammatory reaction to the underlying infection. So in that condition, you tried the antibiotic, it didn't work, and provided that the age is a young child, so in that condition you need to think about carrion. Usually carrion happen in the scalp, however, it can happen in the face, it could happen around the eyebrow, and in that condition it's usually related and linked to animal source. In that condition, you have to ask if there's any pets or if the child come close to an animal recently or was playing with the soil. So in that condition, you will think about Mycosporum canis, Trichophyton, tonsurans, and Trichophyton verrucosum. So If this condition is not treated, it will usually lead to permanent scar, which cause permanent hair fall and alopecia. Usually in those kind of condition, you need to do scraping and hair sample, send it for microscopy and fungal culture. And also you can do bacterial swab if you thought it's secondary associated with secondary bacterial infection. In those kind of cases, topical treatment won't work at all because it's a deep infection and it's effectively and basically inflammatory, acute inflammatory action to the underlying fungal infection. So you have to start treatment with oral antifungal and usually for 6 to 8 weeks in order to improve. So that's the main treatment that you need to do. If it was associated with infection, you need to treat the infection first, and then you treat with the antifungal. And this will help with the settling of the condition, which won't cause any long-time consequences like the scarring and the hair fall. And always, when you send the mother with the treatment, you just need to explain and see what's her thought, and if she's happy to go ahead with the treatment. And always safety net her if there is anything that doesn't seem right, or if the patient is not improving or shown any other sign or symptom that doesn't seem right. You need to bring the patient back again and review the case and take it from there. So by that, I hope that I covered one of the most common case that you can see in children age group and how to treat it effectively and efficiently. Thank you.